6 months ago, a 55-year-old patient came to me with a moderate erectile dysfunction. He had a specifically vascular erectile dysfunction. So I had recommended him to undergo our erectile dysfunction regenerative protocol to improve and potentially cure his condition. This specific protocol included 1 to 2 sessions per week of shockwave therapy, each session lasting approximately 20 to 25 minutes with a follow-up assessment within 2 months post-treatment. So in this video, I'm going to explain whether the shockwave therapy helped to improve my patient's erection, of course after this course, who can safely use this method without side effects, and whether the scientific studies corroborate my patient's results. Hello, I'm Dr. Arkady with ReBalance, and first I would like to explain what the shockwave therapy is and how does it work. Low-intensity extracorporeal shockwave therapy is a non-invasive treatment that uses sound wave to help to repair, heal, and regenerate blood vessels to improve blood flow to the tissue without surgery. The treatment works by sending the sound wave through the skin and into the tissue in the penis and perineal area. This very specific sound wave, they cause very controlled and small injury to destroy the scar tissue buildup, also called atherosclerotic buildup, within a smooth muscle of the wall of the blood vessel, breaks the plaque within the blood vessel, and stimulate regenerative process of neovascularization, forces the body to repair, produce new capillaries, and revascularize the penis tissue, leading to a better blood flow into the area and improve erection function. Let's now look at what scientific studies say about whether shockwave therapy helps to improve erection or not. One of the studies published in PubMed titled Efficacy of Penile Low-Intensity Shockwave Therapy for Erectile Dysfunction, Correlation with the Severity of the Cavernous Arterial Disease, showed a significant increase in erectile function index. It also noted an overall improvement in the blood flow in the cavernous artery. The study found that 93.9% of the patients with mild to moderate erectile dysfunction responded well to treatment, and 72.7% regained a normal erectile function. Amazing. For the patients with moderate to severe erectile dysfunction, about 31.2% responded to treatment, but none regained a normal full function within 3 months of treatment. In 2019, meta-analysis reviewed 10 randomized controlled trials within 872 patients. These studies typically involve shockwave therapy sessions once or twice a week for 3 to 6 weeks. The results showed that shockwave therapy significantly improved erectile function compared to placebo treatments, with many patients experiencing what they call a meaningful improvement in their International Index of Erectile Function, IIEF scores. Now, let's check the results of my patient. At the beginning of the therapy, the patient's IIEF score was 15, showing a moderate erectile dysfunction. Throughout the treatment and from very beginning, the patient never reported any discomfort or side effects during or after the sessions. This actually matches findings from other studies, indicating that low-intensity extracorporeal shockwave therapy is a well-tolerated treatment with practically no risk or any side effects. After 3 months of completing this treatment protocol, patient's IIEF score improved to 22, indicating a very, very mild erectile dysfunction. This 7-point index increase is significant and very similar to improvements seen in other studies where patients' score increased by 4 to 7 points after similar treatment protocols. Within 5 months after finishing treatment, my patient reported a score of 24, showing that the benefits of the treatment not only lasted, but also continued to improve. The patient also reported improvement in confidence and satisfaction in his sexual relationship, which enhanced his overall quality of life. It is important to mention that My patient continued with ReBalance supplements, what we call ED Sexual Enhancement Protocol. He also did therapeutic penis pump home routine post-Shockwave treatment, as well as he continued working on strengthening a pelvic floor with our exercise routine, as well as the overall physical fitness exercises. This particular patient's experience reflects very positive results reported by many clinical trials and meta-analysis of extracorporeal shockwave therapy for erectile dysfunctions. If you feel that you're starting to experience some symptoms of erectile dysfunctions or already have an ED, please schedule a free consultation with me in our clinic in New York City. I will find the most optimum treatment for your case. Best of luck, and we will see you in New York.